So they're trying to vaccinate our children. This is a big deal. Our kids are autistic at a ridiculous rate. 1 in 33 kids right now is autistic. Well, hello and welcome to this week's episode of the Well Health Show. I'm Dr. Ben, so glad that you are listening along. If you're just now tuning in, today's show, we're going to be talking about RFK Jr. in the news. What is he talking about? Let's break it down. I know it's confusing. Sometimes you're probably, maybe even had some debates about this with your spouse or your medical doctor, like, what is he doing? What's he up to? Is he full of baloney? What's going on? So today we're going to break that down very specifically. We're going to talk about Susan Maneras. We're going to talk about vaccines today, which can be a very hot topic. We're going to break down food dyes. We're going to break down inflammation with the oils that he's talking about, as well as I'm going to dive into a little bit of the history behind Big Pharma as well, so that you can understand the ties, the roots that we're breaking and why. So without any further ado, let's dive in. So glad to have you today. Okay, RFK Jr. First and foremost, RFK Jr. I love RFK Jr. He's super funny. He's also not bought. He doesn't care. He just wants people to get well. Dude's got so much money. It's just a different scenario when somebody's got that much money. Personally, kind of a little bit like Trump, because he doesn't care. He doesn't need any more money. He's doing this because he cares. It's not some weird thing. So what is he doing today? Sorry, I diverse. So you see today, they're talking about this CDC director named Susan Maneras. And in order to become a CDC director, you actually get ratified by Congress. Like, it's a whole thing. And they were like overwhelmingly excited about her. And then all of a sudden, within 6 months, she's nobody can stand her. Let's get her out of here. And very specifically, RFK Jr. says, get you out of here yesterday. And she's like, he just wanted me to rubber stamp all this stuff. So that's why I quit and I got fired and I'm sad and blah, blah, blah. Okay, I understand. But what are they talking about rubber stamping? Like, what is the issue? Well, the issue is you have a thing called the ACIP. This stands for the Advisory Committee on Immunization Practices, the ACIP. So here's why this is a big deal. This is a big deal because the ACIP is where you get the vaccine schedule for the United States. That's where you get that we need all these vaccines. Currently, right now it's 90, I think it's 98 or 99 vaccines. It's a lot. It used to be like 12. It used to be none, and then it was a few. Like, if you're my age, I think we had like maybe 6 or 12. Now it's like 98 or 99 vaccines. It's a ton of vaccines, and it's the ACIP that approves these vaccines. Now you got to realize you got to follow the money here. So this is what RFK Jr. is unpacking. Let's follow the money. The ACIP, previous to RFK Jr. being here, was full of people that absolutely had conflict of interest. They're literally, the president of the ACIP sits on the board for the vaccine companies. So what do you think let's see here. Should we put in the vaccine or should we not? Should we make everybody do it? Let's see. If I say they do, then I'm going to make $100 million. So they do. And I know that some of y'all are thinking like, Dr. Ben, like, come on, man. Like, this is a big conspiracy theorist. Like, do you have like an aluminum foil hat? Like, this just sounds crazy, because before vaccines, we were super sick and now we're super healthy. Let's dive into that here in a little bit as well. But we'll go back to it. RFK Jr. put together a new ACIP panel. And just so we're clear, I'm going to put a video up here in a minute. Actually, as a matter of fact, watch this video of this ACIP panelist and tell me what you think he's trying to say. Now that you've heard that, does it sound like he's saying all vaccines are bad? We're just going to throw all this out the window. We're not using medical science. No, what he's saying is we need to debate this. We need to have a conversation about this topic, not just blanket put vaccines in. Now, we hear a lot of other medical doctors right now that are wearing me out because they say, well, we're going to stand on science right now, man. We're going to stand on science. Well, listen, I understand. And the reason I get so passionate about this is because I'm a chiropractor. I'm proud to be a chiropractor. I have a degree in physiology. And I can firmly tell you, after 20 years, I've adjusted over 500,000 people without a single person needing to go to the hospital, without a single person dying, without a single stroke or heart attack or none of that stuff. 500,000 people that have adjusted, different adjustments. None of them got hurt. The medical system is not perfect. Science barely catches up to how amazing God made our body to heal. And when science thinks they have it all figured out, that's when we run into problems like this. We think we know everything, which, by the way, let's just blanket statement. If we had it figured out in the United States, okay? The United States is the most medically funded of any country in the world. We have most access to food. We have most access to doctors. We have most access to medicines, and we are the most funded to pay for all of this. Times 7 times more than the next closest country. We have so much more money and access to healthcare. If the science worked, how healthy would we be? Number one, does anybody know we're ranked in the United States in healthcare? We are currently ranked 57th in the world. 57th in the world. Yet our doctors stand here, oh, I'm the smartest guy in the whole wide world. Science tells me that I'm... So you hear me mocking and condescending. You know why? Because it's not about that. Science has to meet nature, and they meet somewhere in the middle. And I'm not trying to sit here and tell you that, hey, listen, you need to be crunchy and just rub some dirt on it all the time. Most of the time, I do think that. But there is a time, like, listen, if you get, God forbid, into a massive car accident, or I got into a car accident, don't take me to a chiropractor right away. Please take me to a medical doctor. And if they have to shocky thing my heart, or they have to put some drugs in my arm to re-stimulate my heart, please do it. Like, that's amazing. And I'm so grateful for the scientists and the doctors and the brilliant minds that I believe that God gave us that so that we can use it. Here's the thing. What does chronic disease look like, though, when you have a world that's founded by pharmaceutical science and chemistry and engineering? It's not as good as you think. And we're seeing that right now. So that's what we do. That's why Well Health and Chiropractic, that's why I have this radio show, or sorry, this is a podcast radio show also on the weekends, is because we want to educate and we want to inform. I'm 43 years old right now sitting here. You see me, like, I'm not like the strongest guy in the world. I'm not overweight. There's nothing special about me. I haven't been on a medication ever. Last time I went to the medical doctor was when I was 17, other than I had a shoulder surgery and a knee surgery, and that's just because I'm terrible at board sports, apparently. All right? But the reason is there's nothing special about me. I wake up every day with lots of energy, feeling good, and I think you should too. And the reason that I feel that way, again, it's not because I'm special. It's because I work really hard to do the things naturally that my physiology needs. So let's dive into the science some more here and talk about what this means. So they're trying to vaccinate our children. Here's why this is a big deal. Our kids are autistic at a ridiculous rate. Ridiculous rate. 1 in 33 kids right now is autistic. Well, Dr. Ben, we don't want to have measles outbreak. The worst measles ever killed 22,000 people. 1 in 33 kids is autistic. Autism is a big deal. It can be a slight thing on the scale. It can also be an absolute problem for your whole family, and a disability that just disables your child for the rest of their life. It's a big deal. So yes, without question. Well, you don't want to die from measles. I'm good. You know why? Because I'll take my chances with the measles. You know why? Because there is some really good things that came out of science. Did you know of all the things that have ever happened in science, there were actually only 2 massive breakthroughs in science. You know what the main one was? Antibiotics. Antibiotics came out and changed the world as we know it, because things that we didn't used to be able to kill, like diphtheria, doesn't kill us anymore. Like, why would you take a dip? So diphtheria, if you know this, there's this called this gray pseudomembrane. Basically, it covers up over your air and chokes you out because you get this membrane that covers up over your airwave. Like, so you can't breathe and you die. Guess what? A simple round of antibiotics kills that at any point. Like, we don't die from diphtheria anymore because we have a round of antibiotics. Not a big deal. And again, I don't even take antibiotics because we have other products that we use that are natural to antibiotics. Turns out God didn't screw up and didn't wait until 1920s before we were allowed to not all die from something. He gave us some stuff that we were been able to use instead of that. By the way, that's in the show notes if you want to know what that is, because antibiotics help fix that stuff. So we get that, right? So because we took this, like, as science said, hey, we fixed stuff with antibiotics, next step is vaccines. Vaccines fix everything. Well, when you look at the research, that's just not true. When you look at, well, that's not true, Dr. Ben. Ben, vaccines just changed polio. Well, you should look at the research and dive into all the research. Somewhere in the polio, the Salk and Sabin vaccine in the 1955, 1956, when it came out, they reclassified polio. Did you know this? They reclassified it. So it used to be maybe 10, 20,000 people died of polio per year, paralytic poliomyelitis, which, by the way, polio doesn't necessarily kill you. You could get polio as like an infection and it was gone in a couple of days. But paralytic poliomyelitis was a pretty big deal. That's the thing we talk about when you're in the iron lung, paralytic poliomyelitis. Well, there's also a thing where when you have, they just changed the classification. A couple of them, they call it AFP, acute flaccid paralysis. Oh, you don't have polio anymore. Now you have AFP. So they reclassified what the strict definition of what polio is, and then suddenly we saw polio go away. But it didn't really go away. What they were calling polio and acute polio and paralytic polio, like, it was confusing because there were multiple things at play. And then the vaccines took all the credit. And then from that point forward, it was all about the science. And if you don't agree with the science, boom, you're out of here. Which, by the way, this was all a thing. Carnegie, in case you're wondering, let's go back here. So you have two major players. You have Carnegie and you have Rockefeller. Because if you're not learning this for the first time, it's interesting stuff. So Carnegie was steel and Rockefeller was oil. Okay. Carnegie was steel and Rockefeller was oil. And Carnegie was actually about research. That was kind of his thing. And the Carnegie Foundation, the advancement of teaching. In 1910, they came out with called the Flexner Report. So before 1910, medicine was really fragmented. You had a lot of chiropractors starting to emerge. We've only been around for about 10 years at that point, 10, 15 years. So chiropractic was starting to emerge. Holistic medicine was starting to reemerge. You had some weird stuff, crystals and you had some weird stuff. Then you had some medicals, drugs. There was a lot of snake oils, it was weird stuff, right? So that's where the Flexner Report came out. And they basically said, nope, you have to be science-based. And it was actually good in a lot of ways, but it was bad in a lot of ways. It kicked out a lot of things like chiropractic. Well, that's not science, because at the time they couldn't measure the adjustment. Now we can. Spoiler alert, you can, and there is a lot of science around it. So they threw out some of the baby with the bathwater. However, they did throw out some of the bad players and bad actors, which I think is good. It's not the worst thing in the world, right? But they said we need to put science. What they also did is they started putting in institutionalized science in the pharmaceutical industry. And that's where Rockefeller comes in. Rockefeller, of course, was big oil. And they came in and they said, okay, Rockefeller started partnering with biomedical universities, like the labs, inside of Michigan University. And what they did is then they started saying, okay, so in order to do this funding, in order to approve pharmaceutical drugs, we have to test them. So where are we going to test them? And they started testing them in these universities that were funded by the Rockefellers. Okay, you seeing where we're going here? So, which, by the way, when we look at the money from dollars to dollars, Carnegie's would have been worth about, $16 billion in today's money. Rockefellers were about $17 billion in today's money. The pharmaceutical industry is in the trillions of dollars. Their biggest money gain was actually afterwards in university-funded biomedical laboratories and the funding of pharmaceutical medications. That is a massive money dump. So, why this is such a big deal is we see these advancements in science. And there's a couple of holy grails when it comes to medicine that you ain't allowed to talk about. One of them is antibiotics, and the other one you're not allowed to talk about is vaccines. And that's why we have really polarized in our country, because we're talking about right now, I was wait a second, we're starting to crack away the foundation of the American Medical Association when we talk about vaccines. As we should, because the ACIP, traditionally with the CDC, has created this advisory committee on immunization practices. It's totally corrupt. It has always been totally corrupt. It may have started out good at one point, but it's been corrupt for a long time. No, let's put the vaccine. RFK Jr. he is coming through, and he has redone the ACIP. And then Susan Menarez, she was like, wait a second, we don't want to just, go along with the new ACIP. We want to see all the hard data. And the problem with the hard data is data starts to beget data. And what I mean by that is, and chiropractic does this all the time. We have these studies. 10,000 people get adjusted. They'll say, nope, that's not enough. You can't say that because that's too small of a sample size. Okay. So then we'll make 50,000. Nope. Still too small. Okay, 200,000. We'll put 200,000 people in there. Is that good enough for you? Nope, because you don't have whatever. So the science is never good enough when it comes to natural things that oppose medicine. But when it comes to medicine, everything's good enough. Does that make sense? So that's why we really have to watch and making sure that we have the right people on these committees and these panels. And Susan Moneiros was somebody who wanted to follow the false science rather than looking at the issues and saying, because what RFK Jr. was saying was just saying, listen, we have to assume it's broken and fix it. And she was looking at it and saying, we have to assume that it's working and we need to improve upon it. Those are two different mindsets, and that's what RFK is unwinding. So I'll go down quick. We're taking a little longer than that. Food dyes is one thing that RFK Jr. is really working through. Food dyes, it's a big deal. We got to pull those food dyes out because they poison you. They cause cancer. Our red dye 40, we did it, by the way, that was our last podcast. If you missed it, the last podcast, we talked about exactly which food dye causes which disease. Red dye 40 crosses the blood-brain barrier and just toxifies your brain, so it's super bad for you. And then also what he's talking about is fats, and that's going to be your seed oils. And again, I believe we talked about that last. We'll talk about that again here in the future with seed oils and how bad they are for you, because you need to have omega-3 to omega-6 ratio, and seed oils are almost all omega-6, which puts you into really high really high inflammatory state. And all of the research shows that increased inflammation causes disease, heart disease and cancer. So if you truly want to fix heart disease and cancer, you have to remove inflammation. Where does that come from? Primarily seed oils. And that's why we use tallow. And that's why they're trying to fry with tallow, like Steak and Shake. I believe McDonald's just said they're going to use tallow now. That's a great start. Not that I think McDonald's is healthy for you, but at least tallow, you're in the step in the right direction. So that's the stuff that RFK Jr. is really unpacking right now. Again, hopefully we'll get to unpack some more. Hopefully all this didn't just get censored and I'm just talking to myself. But thank you so much for listening along, guys. That's this episode of The Well Health Show. So excited. I'm Dr. Ben. Make sure you tune in the next time. Make sure, by the way, to like and subscribe so you can get more episodes of this. Particularly subscribe, and maybe we'll have to come on some sort of a mailing list, because I can almost guarantee you at some point this show is going to get shut down. But in the meantime, like and subscribe while you can. Thank you so much. I'm Dr. Ben. We'll catch you next week.